We wanted to focus on ACPF this month for our Knowledge Exchange webinar, in part because we soon have a request for proposal that will be going out for ACPF in early November, and we'll tell you a little bit more about that. So I wanted to give you just a quick overview of the program with other resources available on our RNAO website. And then we also wanted to ask a nurse who has completed this fellowship to talk about her experience, why she applied, and really what she gained in terms of her leadership and knowledge. So let me then move ahead and just introduce you to our two speakers today. They'll each do their presentations, and then there'll be time for some questions at the end. So I'm joined today first by Tasha Penney, who is one of our RNAO staff. She is the Manager of Research and Evaluation, and her portfolio includes supporting NQuire, which is the Nursing Quality Indicators for Reporting and Evaluation. She oversees the progress of systematic review and development, which is what we use for our guidelines, and she supports the nursing research associates in their work. She also manages the ACPF program as well, so she's a very, very busy person. She's also a member of the Nursing Best Practice Research Center and the STTI for nursing. She completed her Master's of Nursing at Ryerson with a specialization in health and well-being of communities. She has extensive clinical experience working with marginalized and vulnerable populations with major mental illness and is certified by the CNA as a Canadian psychiatric mental health nurse. After Tasha presents her slides on the ACPF program, then we'll be joined by Lisa Prowd. Lisa is a nurse, a public health nurse at the Grey Bruce Health Unit, where she has worked as a public health nurse for the past 13 years. Lisa has experience working in a variety of public health programs, including her role as a best practice champion for the implementation of an organization-wide RNAO best practice guideline. As part of her participation in the ACPF program, she's gained knowledge in research and leadership skills and been better able to engage organizational champions and influence practice change within public health. So delighted to have both Tasha and Lisa with us today. Do hope that you will find this helpful for any of you who are considering the ACPF. So first I'm going to turn it over to Tasha, who's going to give us a short overview of the ACPF program. Thanks, Tasha. And we're going to record the session as well for today.
Okay, well, thank you, Catherine, for that introduction. So hello to all of you out there in the webinar world. This is Tasha speaking. So Catherine has asked me to be here this afternoon to give you an overview of our Advanced Clinical Practice Fellowship Program, which is offered by the International Affairs and Best Practice Guidelines Center here at RNAO. So just bear with me because I'm going to be changing slides and speaking at the same time. Okay. Oh. All right, great. Okay. So I'm only going to take about 30 minutes to go over this program. There's a lot of information, and if there's some things that I'm saying where you need some more details, you can go to our ACPF website, to the RNAO website, to get more information. As well, you can contact Erica D'Souza. She is the project coordinator for the ACPF program and very knowledgeable on everything that goes on. So for the next 30 minutes, I'm just going to give you hopefully an understanding of what ACPF is, and then help you to understand what are the eligibility requirements for you to be able to participate in this program, as well as recognize the 3 key elements for the fellowship. I'm just going to briefly go over all 4 of our different, we will call them streams of fellowships, and then go over how you apply, and then how your application is then reviewed and selected for the fellowship. And then I have a few slides on where you can go for extra support or resources if needed. Okay, so what is ACPF? ACPF is RNAO's fellowship program, like I said, which has really 3 main benefits. First, it allows for a unique opportunity for registered nurses and nurse practitioners to meet a specific learning need within their organization with RNAO support. It also fosters a nurse mentoring opportunity because one of the criteria for this fellowship is the applicant has to have a mentor. And finally, it helps the nurses organization improve patient care by way of educational development of the nursing staff. So you can see there, what's on my right-hand side is the ACPF triangle and the relationship between the fellow, the mentor, and then the organization. So just so you know, in ACPF language, when we're talking about your organization, we're referring it to as the sponsor organization because they do provide some funds towards the fellowship. Okay, so eligibility requirements. You need to meet 5 requirements in order to be eligible for this fellowship program. So first and foremost, you have to be a registered nurse or nurse practitioner working in Ontario. But if you're not working in Ontario, at least living in Ontario. You need to have 1 year minimum nursing experience, and we get this information because we ask you to provide a CV when you do apply. So that's one way we get it. You need to be employed full-time or part-time and are able to dedicate 450 hours to the fellowship. So when you are thinking of applying, one of the requirements you need to make is to make sure that your organization has given you written approval that they're going to allow you to dedicate that 450 hours. And it's 450 hours either broken up full-time or part-time. You need to have a mentor in your area of focus, and I'm going to go into a little bit more about what that mentor, who that mentor should be. But again, when you come ready to apply for the fellowship, you already have to have identified a mentor. And then, of course, you need employer support. So like I was saying, your organizations can provide some financial and material support towards the fellowship, as well as giving you time off to do it. And ideally, your organization has a culture of learning in which they'll really, senior management will really support you through these activities. Okay, so next I'm going to talk about the 3 key elements of the fellowship. So they are the applicant, so yourself, the mentor, and the organization. So I'm going to go over the 3 of them now a little bit more in detail. So the first element is the applicant. So this is the registered nurse or nurse practitioner who, is applying for the fellowship. Now, the applicant's role is really to develop and submit the proposal or RNAO. So this person will do the bulk of the work. Of course, they'll make sure that their learning objectives are being met, that they're involving the organization throughout the whole process, and then definitely, finding a mentor, but also accessing that mentor throughout the fellowship. And we do actually ask for some sort of, evidence of that through your learning plan. And then finally, the applicant's going to submit the final report and the executive summary to RNAO at the end of the fellowship. Going back to ACPF language, within the RFP and the application, the applicant is referred to as the fellow. Okay, so the second key element is, of course, the mentor. So they play a crucial role because they provide the fellow with feedback and suggestions about their learning goal and their learning plan. So we really encourage that if you are going to apply for this fellowship, that mentor, doesn't just come on board after you have the learning plan developed, but it really helps you to develop it. They will provide you extra education as needed in their area of practice. And they should be able to provide you with opportunities through either job shadowing or guided site visits, which you might be using as strategies to meet your learning need. They will monitor your progress and should be able to meet with you regularly, and again, that will be outlined in your learning plan. And then they have a major role in evaluating your outcomes from your learning plan and your learning goal. So in the learning plan, we ask how are you going to evaluate, the strategies you put in place and your outcomes. And really the mentor should be, their name should really be in each of those boxes and how they're going to help evaluate. And they can also assist with completing the final report and much, much more. They can be used in more ways than what I've just listed. So I just want to go a little bit more into the mentor because we get asked a lot about, who should the mentor be and can I have more than one? So in the application or RFP, you're going to see primary mentor. So this individual has to be a nurse, and they have to be prepared at the master's level. But they don't necessarily have to have a master's in nursing. They need to have expertise in your fellowship topic, and in the application, we do ask for information about this individual to make sure that they're a right fit. Of course, they have to want to be your mentor, and they want to help you prepare your proposal, and as well all the activities that you're going to go through to meet your learning need, and then of course evaluation. So that's very, very important. I just want to say, if you're having trouble finding a mentor, I would suggest that you contact again Erica D'Souza, our project coordinator, and she may be able to assist to link you with a potential mentor, because she has a lot of that information from past fellowships. Okay. So then again, we get asked a lot, can I have more than one mentor? Sometimes the primary mentor, it's not enough to help you with your learning needs. So the short answer here is yes, absolutely, and it's referred to as a mentorship team when you have more than one. So you still have to have your primary mentor, and that person has to meet the requirements from the slide previous. But you can also ask others who have a different range of educational and professional background who could also assist in your learning. They can be external to your organization, and they can either have clinical expertise or research expertise, depending on what it is that you need. So if you are going to have a mentorship team, all of their information and what role they're going to play specifically in the fellowship has to be outlined in the application. So finally, the third element that's very important to ACPF is, of course, your organization. So when you have come up with a learning goal that you're figuring you're going to want to explore through this fellowship, they'll be able to help you match that to with a need that's within the organization. They will provide you, again, with the release time, so the 450 hours from your regular duties for the duration of the fellowship. And they supplement the funding of the fellowship, and they're required to provide a minimum of $5,000. So we ask for a very detailed budget in the application, and that has to be outlined there. They'll also make sure that you have the necessary human and material resources needed for support. So, that could be, a librarian that will help you do with your lit search, or papers, or, photocopying, things like that. So really hold senior management accountable to support your fellowship. And they should be able to demonstrate support for you and for this, your fellowship activities. And then there is a piece where we ask, how is your organization going to help with long-term sustainability of the skills and knowledge that you have gained? So now I'm going to move into the fellowship types, and as I mentioned before, there's 4 types. So there's the clinical leadership, then there's the best practice guideline implementation stream, and then our very new stream, the AMS RNAO stream. So just so you know, when the next RFP for ACPF is issued on November 2nd, the RFP for the clinical leadership and BPG stream will be separate from the RFP for AMS RNAO, because it is slightly different. So now I'm going to go over them briefly, but again, if you need more information, please go to our ACPF webpage. Okay, so let us start with the clinical fellowships. So this is one of our very popular streams, I would say, and this is when the nurse has decided that they need more learning with respect to some clinical aspect of their practice, and that's usually involves some sort of provision of, direct care to a patient, client, or family, or community. So I thought I would put some examples from past fellowships from the clinical stream. So one of them being chronic pain management in the substance-dependent patient population, and then pressure ulcer prevention in the adult acute care setting. So as you can see, this is really clinical focused. The second stream is the leadership stream, And the leadership stream focuses on, the nurse interested in this is focused on developing skills and expertise that will support, nursing practice and the profession as a whole from a leadership perspective. And then within the leadership stream, there are 4 types of foci that the applicant's asked to focus on, and that's the education, management, research, and policy. Just to give you some examples of what that means. So the education stream within leadership is, focused on nursing education or client education. So I have an example here, past fellow leaders and learning strategies to best implement, an education program for nurses on an inpatient unit. Then there's the management leadership stream, and nurses here, they're wanting to focus on, providing leadership in care programs or, management of human resources, clinical programs, and program development. So an example from a past fellow I've pulled here is developing skills and development of strategic plans, program development, and program evaluation. The research stream is everything research. I'm not going to read that out, but there are nurses who are interested in, developing skills and expertise from a leadership perspective within the research area. So we had a fellow do a fellowship on enhancing, their skills to develop a research proposal, and it was very specific to the area of practice. And then finally, the last foci within the leadership stream is policy. So if you have any interest in developing areas or expertise in policy, this is a good fellowship. And then we had an interesting one here, advocacy and change management in the area of supporting increased breastfeeding environments. So that was leadership. So now I'm on the 3rd stream here with an ACPF, and that's the best practice guideline implementation. Now, this is also a very popular stream in addition to our clinical stream. So if you're interested in this stream, it's because you want to learn how best to, implement best practice guidelines within your organization, and as well as how to, increase the uptake of the recommendations within a particular guideline. So we see a lot of examples of these. The one I pulled here is, supporting best practice for patient care. So this fellow was interested in implementing the pain guideline within their organization. Okay, so this brings me to our most recent stream that we've introduced. It's called the AMS RNAO Fellowship. So AMS stands for Associated Medical Services, and they're a small Canadian charitable organization that has partnered with us here at RNAO, and they are offering 8 fellowships a year for 3 years. So we're providing funding for this. Now, they're very unique in that in this fellowship, the applicant is asked to focus on some type of activity that will support humane, compassion, person-centered care in nursing, so quite specific. And there's 3 core themes. They use the term core themes, but really the applicant has to focus on one of these core themes throughout their application, and I'm going to get to that in the next few slides. So we had an excellent example recently. This is brand new. I think that AMS started probably a couple of months ago, and we've already had interest. So we have an applicant working right now, and their idea is providing compassionate client-centered care to patients with dementia in the long-term care facility they work in. So these are the core themes by AMS, and I'm not going to read them out, but I have just underlined sort of the gist of them. So, if you are interested in the AMS fellowship, you're going to be asked to pick one of these core themes and address it within your learning goal. So self-identity is anything or activities you will do to sustain compassionate care within your clinical practice. The education theme is things that will enable compassionate care, maybe within the unit. And then work environment. What are those healthy work environments, the things that will support compassionate care to the clients that your unit provides care to? And I'm just using unit as an example, but I know we have fellows from all types of different health sectors. So as I mentioned before, the RFP and the application for the AMS Fellowship is separate, so just make sure if this is the one you're interested in that you have downloaded the right one. And in the application, again, you're going to be asked to highlight the core theme on which your learning is focused. Now, you get a few additional benefits of being an AMS RNAO Fellow. They will feature you in one of their AMS newsletters if you are successful in completing. And then you are required to attend, but I really do think it's an exciting opportunity, their annual two-day Phoenix conference. And at this conference, there's leaders in humane compassion-centered care that come and speak, as well as you'll have the opportunity to network with past AMS fellows and talk about your work in this area. So I'm actually going to be attending this year in November to get a feel of what that's like, and I'm very excited myself. Okay, so, you've heard a little bit about like what makes you eligible for this fellowship, and then the different streams that you can choose from. So I just want to talk a little bit about how you apply, what the review process is, how do we select fellows. So in terms of applying, you're going to be asked to submit a very detailed proposal, and I'm not going to lie, it may seem pretty daunting at first. It is very detailed, but it's better to be more detailed because we'll make sure that you have all the resources that you need right up front. So you're going to provide information about yourself, your mentor or your mentoring team, and then information about your organization that shows that you have the support that you need. You're going to talk about what is the need for your project, like what was the gap in service or a client need that has pushed you to want to complete this learning goal. Again, you'll have this budget that you will outline in the application. As well, you're going to have to fill out a learning plan. Now, the learning plan is worth 40%. So when you submit your application, it's reviewed. It's each section has an overall score, and the learning plan is has the greatest weight in terms of what it's worth. And just a little note here, so typically our RFPs for ACPF, they're issued in November with a deadline in mid-January for you to put your application in, and then again in March with a deadline in May. Now sometimes we will issue a third RFP, and that's based on, the number of previously awarded fellowships. So we follow a quite systematic and rigorous process here in terms of reviewing. So the proposals that are submitted go to an external reviewing team. And typically the people that are reviewing their previous fellowship participants or their staff within BPSOs who are asked to be reviewers. So they're given a very detailed tool to use to appraise your proposal, and they provide an overall scoring on that. But we make sure that reviewers have training questions on how to actually use this tool, and then we make sure that there's inter-rater reliability. So each proposal is actually reviewed by 2 to 3 reviewers, and we want to make sure that there's general consensus so that when we get your final score, that at least 2 to 3 other people have agreed that that's really what it is. Now, once your proposal has been reviewed and scored, you're going to be notified of whether or not you've been accepted into the program or declined. So I just want people on this webinar to know that even if you have been accepted, please expect that there are going to be some additional revisions that we're going to ask you to do, and this is very typical. And then if you're declined, we also provide very detailed feedback, because the idea is that we would love for you to try again in future with the feedback that we've provided to hopefully strengthen your proposal. Now, in terms of how we make the selections here at RNAO, it really is based on your final score. So typically we'll convert that into a rating scale of, strong, moderate, weak. And then the proposals that are strong, they go right through. Those that are moderate may go through, but there will be some, extensive revisions required. Whereas if it is score weak, we'll provide detailed feedback but ask you to apply at another time. Okay, so I'm just getting near the end of my presentation here, and I wanted to give you a slide here on additional resources that you can go to for extra help. So right away, so the RFP is actually really excellent. It's very detailed. Everything you need to know that for applying to the fellowship is in the RFP. And of course, there's the proposal template, so you know exactly what information you need. I would suggest that you look at both of those things together if you're considering applying. We hold workshops throughout the year. They're live, and I do them with Erica. Now, recently we started recording them because we realized that frontline nursing staff, they don't always have an opportunity to get away to attend a live webinar. So we will continue to provide them live, but also record them and start uploading them to the website so that people have opportunities to go and listen to them on their own time. We have info sheets, so there's one for, mentors and managers. So if they're not familiar with ACPF, you can provide this to maybe a potential mentor or your manager so they have an idea what the program is. Also, if you're not quite sure what stream you want to go into, there's a What's My Stream questionnaire. But just so you know, the AMS one, because it's so new, it's not within this questionnaire. This questionnaire helps you decide between the clinical leadership or the guideline streams. And then you can, again, contact Erica. I keep plugging Erica, but she does have samples of successful proposal elements that she can share with you if you're interested. So if you are interested in applying, I really recommend that you attend our webinars. So they are starting again in November. I don't have dates on me, but it is on our website. It has been posted. So I do a webinar on how to focus your fellowship, so how to pick a learning goal and focus it. And then I do a webinar just on the learning plan itself to hopefully help you be successful when you go to fill that out. And then we hold a few Q&A sessions for people who are in the process of filling out their proposal and want to ask some questions, or for those who are thinking about it. Now, this presentation that I just did, this is our general information session, and this one actually has been already uploaded to the ACPF website. I will apologize. I heard the audio quality is not the greatest, but I mean, if you feel like there's someone that's on this webinar right now that should have this information, please feel free to watch it, and hopefully the sound isn't too terrible. We will be fixing it. And we also encourage you to invite, if you're really interested, invite potential mentors or, senior management from your organization so they get an idea what this is all about too. So on our ACPF page, we have the events calendar, and like I said, you can see when the upcoming workshops are. So just important dates to remember because it's coming up quick. On November 2nd, we will be posting the RFP for the different fellowship streams. Intent to submit date is January 8th, and then the actual submission deadline will be January 15th, 2016. So thank you for listening, and I'll pass it back to Catherine.
Thanks, Tasha. That was a great overview of the program, so I'm sure that some of you may have some questions. But first, what we'd like to do is ask Lisa Prowd, again, public health nurse from Grey Goose, just to present her story of why she applied for ACPF and what the experience is like. I think it would be a helpful add to the presentation from Tasha. Thanks.
Great. Thank you, Catherine, for the invite today and for the introduction. So in the next 20 minutes or so, I hope to share my fellowship experience with you and perhaps inspire you to think about embracing such an opportunity as this, and or support someone who may be in the process of either preparing for a fellowship or currently completing a fellowship. Okay, so there were several reasons why I decided to apply for a fellowship in 2014. First of all, back in 2012, I saw firsthand one of my fellow nursing colleagues complete a fellowship and the opportunities that she had within her learning plan to gain new nursing skills, in particular leadership and knowledge in implementing best practice guidelines. As a best practice champion myself for an organization-wide best practice guideline, I too wanted the opportunity to further my nursing skills. And at that time, I had about 2 years experience utilizing the RNAO guideline toolkit and applying the knowledge to action process to develop a guideline implementation plan, a gap analysis, identification of key stakeholders, and utilization of resources. So there was definitely a direct link between my current role as a best practice guideline champion and the desire to continue learning new skills and knowledge related to guideline implementation. So for this reason, I chose the Guideline Implementation Fellowship versus the Leadership or Clinical Care stream, so my personal learning plan could support my efforts to implement, practice, evaluate, and sustain best practice guidelines. And since 2012, our health unit has been striving to build a culture of quality and accountability through opportunities such as accreditation and becoming a best practice spotlight organization. So the entire organization, from the top down and the bottom up, has been embracing best practice opportunities, and my fellowship certainly supported this existing momentum and the commitment of the organization to pursue excellence and strengthen evidence-informed practice. And lastly, applying for a fellowship is a yearly requirement of becoming a best practice spotlight organization in the candidacy 3-year term. So the timing was right for both me and for the organization, and I had 100% support from my organization from the preparation phase all the way through my fellowship, and even now as I'm a post-fellow. Okay, so there is some preparation required for the application process. For me, it did require organizational support and definitely a coordinated approach. My manager at the time and I both participated in the RNAO webinars to better understand the fellowship experience. We also reviewed the online fact sheets and the role of the mentor. And during the proposal development, I coordinated meetings with organizational staff to assist me in the completion of all those different components that Tasha mentioned, the proposal budget, letters of support. I did contact our IT department for some help and certainly consulted with program evaluators in regards to my learning plan and to help me review my overall proposal. So I really felt it was beneficial in that organizational staff were aware and very supportive in helping me to achieve my fellowship goals. Writing the proposal took a great deal of time, but it was a very rewarding experience when it was all completed. Working as a frontline nurse, it was a great opportunity to sit down and practice some of my writing skills and seek supporting evidence. And receiving the proposal feedback from the RNAO certainly strengthened my learning plan and supported further detail and enhanced evaluation strategies for monitoring outcomes. Since our health unit was in the 3rd year of our BPSO candidacy, it seemed fitting that my overall learning goal would be to increase my knowledge and skills on sustainability of best practice guidelines in a public health unit. So I really focused on what I wanted to learn instead of what would I like to do. In order to achieve my learning goal, I utilized a variety of strategies in my learning plan that I'll highlight in the next couple of slides. As Tasha mentioned, having a mentoring team to help facilitate your learning during your fellowship is a requirement, but the question I had was, of course, who would be on my mentoring team, and should I include external mentors, and would they be willing to mentor? So based on my learning objectives, I needed a variety of mentors with knowledge and skills in research, leadership, and knowledge translation related to implementing best practice guidelines. My primary mentor ended up being my manager here at the Health Unit for the implementation of the Client-Centered Care Best Practice Guideline. And our BPSO coordinator at the time also had experience implementing and sustaining an organization-wide best practice guideline since 2010. So she also agreed to be part of my mentoring team. Externally, Toronto Public Health was our organizational mentor for our health unit. Therefore, I contacted the BPSO project coordinator at Toronto Public Health, May Tao, very early on in my fellowship planning, and this was extremely beneficial. Not only did May give me some advice about writing the proposal, but she also agreed to be part of my mentoring team. And through May, I met an assistant professor at the University of Ottawa who was also a senior research associate, and she also agreed to be part of my mentoring team. So both my external mentors were experts and shared knowledge through consultations and organized site visit and expert interviews. Okay, so when I look at my overall learning plan, there were three core areas of learning: research, leadership, and knowledge related to best practice guidelines. Through scheduled telephone consultations with our hub librarian and on-site library training here at the Health Unit, as well as email consultations with my mentor at the University of Ottawa, I was able to achieve many of my learning objectives related to research, including a search strategy, data analysis, and writing a literature review. My external mentors assisted me to conduct a comprehensive literature search and synthesis of knowledge related to sustainability of a best practice guideline. Another strategy used to achieve learning objectives related to research knowledge was through participation on the Nursing Best Practice Research Unit Publication Support Group. This group provided peer support, networking, and monthly sessions to discuss the process of writing and publishing. And submitting an article manuscript was another requirement of becoming a BPSO, so it was a good fit. So this picture here, as you can see on the screen, is a picture of myself, my mentor May from Toronto Public Health, and Dan Nagel from the Nursing Best Practice Research Unit. May and Dan invited me to co-present with them at the BPSO Symposium on Publication Success. So I was able to share my experience and lessons learned in writing for publication. One of the benefits of having external mentors is the opportunity to build partnerships and collaborate with other community health organizations. My mentor from Toronto Public Health is an exceptional leader and took her mentorship role very seriously. She introduced new and innovative opportunities for me to learn and enhance my skills in community health nursing. Her commitment and enthusiasm in mentoring was outstanding and continues to be outstanding and inspirational. So this picture here is an example of an opportunity I had in my fellowship to collaborate with public health units, BPSO colleagues. There's Thunder Bay District Health Unit and Toronto Public Health, and we collaborated together on writing a conference abstract and delivering a presentation on becoming a BPSO to advanced evidence-informed practice at the OPHA conference. And my mentor, May, again, supported me through this experience of presenting in partnership. I was also able to practice and enhance my leadership skills by championing and facilitating our own organization-wide client-centered care committee. And lastly, another unique opportunity I had was participating as a panel member representing public health practice in the revision of the Client-Centered Care Best Practice Guideline, which is now titled Person and Family-Centered Care. So this opportunity involved teleconferences, face-to-face meetings, group work, and a review of the literature using the AGREE instrument. And it also coordinated very well with my learning objectives related to research. So just to make note, some of the opportunities that I had during my fellowship kind of came up unexpectedly. So I learned very quickly that it was okay to be flexible, even when it wasn't included, the strategy wasn't included in my original learning plan. So lots of opportunities came up as my fellowship evolved. So in relation to knowledge, throughout my fellowship, all of these listed strategies and experiences that you can see on the slide certainly allowed me to gain knowledge on effective sustainability strategies and developing a sustainability plan to support evidence-based practice, organizational systems and infrastructures that act as facilitators and barriers to support sustainability of a best practice guideline, and principles of adult learning to facilitate knowledge transfer and engagement strategies to motivate best practice champions. So I can't say enough how important the value of mentorships was for me, and the knowledge and the skills I gained from my mentoring team. That was extremely valuable. And two of my mentors supported me with an organizational site visit to Toronto Public Health to explore strategies and gain insight on sustainability of a guideline implementation, as Toronto Public Health was a BPSO designate site. It was a very positive learning experience being able to meet with best practice champions and leaders within the organization who are committed to building and sustaining an organizational culture of best practice. And I also had many opportunities, internal and external, to disseminate and share the knowledge that I was gaining from my fellowship through committee meetings and webinars. Although I spent many hours, as we know, I think it's still the same, 450 hours for a fellowship. I spent many hours working primarily at the health unit, but I also had many opportunities to spend time off-site. Some of my learning outcomes were measured through summary report from an environmental scan identifying the internal systems and infrastructures to support sustainability of evidence-based practice, a summary report that I wrote highlighting key findings from the organizational site visit to Toronto Public Health. I also did some reflective journaling to demonstrate success and professional growth along the way. It was also used as a tool for critical thinking and reflection of knowledge. Continuous feedback was shared from colleagues, external partners, champion surveys, and of course my mentoring team. I did meet with my primary mentor on a weekly basis just to check in. And feedback from our hub librarian to ensure that a comprehensive literature search was conducted, and she certainly provided me with ongoing feedback as well. Staff education and training through knowledge translation and facilitation of the Client-Centered Care Committee demonstrated leadership skills to support and engage champions. And lastly, our Client-Centered Care Best Practice Guideline operational plan includes strategies for sustainability, as well as our organizational project planning template has a sustainability component now as well. So as a result of the fellowship, I felt like I gained expertise in being able to act as a leader and a resource for public health, as well as cross-sector champions implementing and sustaining best practice guidelines. I certainly gained an increase in confidence to transfer knowledge and motivate champions throughout our existing infrastructure. And my primary mentor certainly played a fundamental role in guiding me within our own organization to lead, to showcase my work, and build confidence in my role, not only as a public health nurse, but really believing in myself as a leader. And this picture on the slide is a picture that was taken at the Community Health Nurses of Canada conference that was held in Winnipeg, that I felt very fortunate and privileged to not only attend, but to be able to present with one of my mentors, May Tao from Toronto Public Health this June. So that was a great opportunity. So my fellowship, for me, I feel like it was really just the beginning. I feel more motivated and inspired to share my experience through writing, presenting, and mentoring others, to support and inspire others to increase knowledge and skills on research, evidence-informed practice, and sustainability planning. May and I are planning to collaborate. We are collaborating right now, actually, and hopefully for the next year, to write about our mentorship experience for publication. I also would like to explore strategies to share knowledge. As I mentioned, May and I this June had the opportunity to present advancing best practice knowledge through an innovative partnership and mentorship strategy in Winnipeg at the National Conference. And of course, to always continue learning. Throughout the fellowship, I was able to identify some of my learning strengths and weaknesses. I did learn that mentoring is about opening up possibilities for learning, as one of my mentors often reminded me that working together adds value. So I hope to collaborate with leaders and mentors, both external, cross-sector, and internal, and really use our internal quality improvement committee as an alliance to advocate for sustainability of evidence-based practice. So thank you for listening to the webinar today, and I hope I was able to provide you with some insight into the fellowship program and the experience that I had. I certainly would encourage anyone to consider the opportunity to apply. Even the proposal writing is an opportunity to explore a learning plan and to work collaboratively with your organization and mentors to support your professional development learning needs. And in the end, it also benefits and builds capacity within your organization. I felt a sense of satisfaction knowing that my fellowship success was an accomplishment for me. It certainly helped to improve my job performance, and I was always recognized by my organization for strengthening our culture of evidence-informed practice. So hopefully that gives you some insight, and thanks again for listening, and thank you, Catherine, for the invite today.
Thank you for that, Lisa, for your presentation and for sharing your experience in the application and what it's meant for your career. I think that personal story really says so much to those who are considering applying. Now, I do see some questions, because now it is time for questions, and we have about 15 minutes. First let me pose just a few logistical questions to Tasha, and then we'll have some for Lisa as well. So, Tasha, I want to know, are the mentors, are they paying for any of their work and time? The number of applicants who typically receive, and for those who choose to complete their fellowship on a part-time basis, what does that look like as far as in a typical work week? How many hours would they be spending in their regular job, if you will, and then how many hours spent engaged in the fellowship?
Okay, so thanks, Catherine. Great questions posed there. So, okay, I'll tackle the first one. So, no, mentors are not paid. So, as I was saying, when you do go out there to pick your mentor, it has to be someone that really wants to be involved and help you and volunteer their time. Now, in terms of success rates, so it really varies. I can't really just give one number, but I can give some numbers from our past 2 cycles to give you an idea of what we get. So 2 cycles ago, we had 13 proposals come in, and out of 13, 8 were accepted to go through, so about 61%. And then in this last cycle, we had a little bit more. We had 23 proposals come in, and 17 of those were accepted, which is about 73%. So just to give you an idea. But again, like I said, it varies. Now, in terms of full-time and part-time, so it's 450 hours regardless, but when that's full-time, what that looks like, it's 12 weeks you working on this fellowship. So you're not working, essentially. But part-time fellows are working. The fellowship then takes about 20 weeks, so it's about 22 and a half hours per week that you're dedicating to the fellowship aside from your work. So I hope that clarifies.
Great, thanks, Tasha. Now, let me raise a couple questions for Lisa, and again, if you have questions that you're wanting to ask, please don't hesitate to put those in the chat box. So Lisa, just tell us about some of the challenges of working with the mentorship team. You certainly had a wonderful mentor in May, but what were some of the challenges?
Hi, Catherine. So yes, there were a few challenges, nothing that we weren't able to overcome or I wasn't able to overcome with my mentoring team, but certainly having external mentors forming that relationship, when you're internal, I was able to meet with my primary mentor face-to-face every week, but certainly having external mentors and forming that relationship when you don't have the one-to-one FaceTime can be a challenge. So lots of email consultations, lots of teleconferences, and that seemed to help us collaborate together. But certainly coordinating time to work together as well and having access to mentors. So really, we talked about it quite a bit as we were developing abstract submissions and presentations. How do we form a relationship using virtual technology? And it did take some time working with IT every now and then to make sure that we were able to work together effectively through virtual technology, but we were able to successfully write the abstracts and create presentations online. And I think dealing with conflicting priorities and finding a balance really between direct nursing work and the fellowship or project work, I did sometimes have to really set the time aside for my fellowship and block that time off because it can be difficult to find that balance and when there is conflicting priorities in your everyday work. So I think those were some of the biggest challenges for me. And as I said in the beginning, finding a mentoring team that was really going to meet my learning needs was a bit stressful, but it all seemed to come together. And really it's just reaching out and asking for some help and seeing really who's out there and interested in being a mentor.
Thanks, Lisa. Another question, how are you sustaining your knowledge and skills after completing your fellowship?
Well, I really did try to put together a post-fellowship plan to continue sharing the knowledge and skills that I had gained. So I continue, as I am today, to share presentations outlining some of the knowledge and skills that I gained, certainly through webinars and organizational committees as well. I did continue post-fellowship as an individual member on the Nursing Best Practice Research Unit Publication Support Group, and trying to think here, the RNAO panel expert group that was also continued on post-fellowship. It went till July of this year. So some of the groups that I had joined during my fellowship certainly led, the timeline went past the fellowship, and that gave me a good opportunity to continue on with the work. And certainly maintaining partnerships with my mentoring team and exploring opportunities for collaboration has been ongoing. As I mentioned, May and I are continuing to work together. We teleconference once a month to talk about a future publication manuscript. And we're always talking about, what's next for us? How can we continue to work together and collaborate on best practice knowledge? So I think it's ongoing, and certainly things come up as my role. I continue my role as a best practice champion for the client-centered care guideline, and our team is now discussing implementing a new best practice guideline. So I'm really excited about that as well.
That's exciting, Lisa, and I'm sure they'll be looking to you for leadership and knowledge in that. A question from Beth. She asks, is there ever an exception to the prerequisite educational requirements for application? And I'm assuming that she means for the mentor. So, Tasha, are you able to answer that question?
Right, okay. So, yes, the person that's going to be identified as the primary mentor in the application does have to be a nurse with a master's of some kind. However, the reason why we do suggest mentorship teams is because you have to have that person that's a nurse with a master's. They might not necessarily have the research or clinical expertise that you would really want to tap into, and that's why you would go to other people to sort of fill in that gap. But definitely primary mentor has to be a nurse with a master's of some kind.
Thanks, Tasha. I have another question, this one for Lisa now. How does the organization continue to support knowledge exchange and professional growth related to best practice? what have they been doing at Great Reefs where you work?
Well, certainly throughout my fellowship, I had an opportunity to chat with some of our key stakeholders, including our medical officer of health, to really talk about how we can use our infrastructure to incorporate sustainability planning into our operational plans. And as I mentioned, we have a new project planning template that is used organization-wide that really helps programs, teams, and staff to incorporate evidence-informed decision-making and evidence-informed practice into their program or project planning, as well as there's a sustainability component to that template. So that was really exciting to see it kind of embedded into our planning templates. Certainly management encourages and supports frontline staff to incorporate best practice and sustainability planning into their yearly professional development plans. And really are encouraging staff, and I'm always telling my colleagues, you know, to access resources. We also have our library resources, but we also have annual library training to learn how to access evidence. And for me, that was really beneficial. I think sometimes it's hard to take time out of your everyday and that frontline work to attend training, but that training in particular was really helpful for me in my fellowship and in my everyday work. So encouraging staff to access resources, library training, mentorship, you know, whether it's in a formal fellowship style or just in your everyday work, having a mentor that you can consult with, participating in interdisciplinary working groups to advance best practice knowledge, and learning about tools to support evidence-informed practice. So we can learn how to incorporate evidence into practice, as I said, in our everyday work. So I think it's really, the organization has really taken a momentum in helping us as staff members to move evidence-informed practice forward by embedding it into some of our infrastructures.
Thanks, Lisa. We have one last question before we wrap up. And again, from Beth, thank you for clarifying. So she indicates she is an RPN with exceptional knowledge, skill, and background who has worked far beyond her scope. So she's wondering, is she eligible for RNAO's ACPF program?
Okay, so if you are, if we're understanding this question correctly, if you are an RPN, there is a fellowship program that's offered by the RNAO, so you can go there to do fellowship. But for our fellowship program, you have to be a registered nurse or a nurse practitioner. Now, if I'm understanding this question to mean if you're an RPN, could you be a mentor? You could definitely be part of the mentorship team, and I think that would be incredibly valuable, but couldn't be designated as the primary mentor.
Thanks, Tasha, and hopefully, Beth, we've answered your question, and if not, certainly please email us again. It is 2:29 now, and we will need to say goodbye, and thanks to everyone for attending today's webinar. You will receive a link for an online survey to evaluate today's presentation. You also can give us some suggestions regarding any future topics that you'd like to see as part of our knowledge exchange. We will, once you've completed the evaluation, then send you a certificate of attendance, if that's something you're needing. Next month, in November, on November the 12th from 2 to 3, we have a presentation from Kim Bolton. She is a nurse from the Scarborough Hospital, and she's going to be talking about how she's led some work at that hospital, embedding the BPG into everything we do. So not as an add-on, but really making it part of the culture of that acute care setting. So we look forward to that presentation, and again, thank you all for attending today. Thanks, and goodbye.